Welcome to the Pain-Free Athlete Podcast. I'm your host, Dana Jones. I am a certified personal trainer, and I'm here to help you achieve your fitness goals without pain. In each episode, I'll share tips and strategies that will help you stay safe and pain-free while you're working out. I'll also interview experts in the field of fitness and pain management. So if you're ready to learn how to stay active and pain-free, then subscribe to the Pain-Free Athlete Podcast today. Hi, everyone, and welcome to the Pain-Free Athlete Podcast. I'm your host, Dana Jones, and today we are joined by Dr. Kate Mihevc Edwards. Yes, a physical therapist, board-certified orthopedic specialist, and an expert in running medicine. With over 15 years of experience helping high performers, CEOs, and athletes from recreational runners to Olympians, Kate leads the Precision Performance Running Medicine Clinic in Atlanta, co-founded the RunSource app, and co-hosts the interdisciplinary Case Miles podcast. She also is part of the multidisciplinary team supporting Atlanta Track Club Elite and serves as adjunct faculty at Emory University of Medicine. Her work continues to shape education, research, and the future of sports medicine for runners everywhere. Welcome to the show.
Thanks for having me, Dana. That was a mouthful. I'm
You
so
did a lot of
sorry.
stuff. I was like, I'm doing okay. No, I'm not doing okay.
No, you did great.
It's all
That's
right.
a lot of stuff. Even I wouldn't remember all that.
Well, that's why I'm reading it. No, it's all good. So we connected because we were talking about pain and we were talking about running and we were talking about women and all kinds of mental health kind of stuff. And so you have a very unique story. And I'm wondering if you would possibly share your diagnosis of ARVC and like, how did that, I guess, put you in check, right? Is probably the easiest way to say it because you definitely got your butt put in check. So
Yeah, I got it kicked across the country, basically. So I had run 13 marathons and done several triathlons, short course mostly. And I was actually training for a half Ironman. And I had just had my son, and he was actually a year old on the day that I went out for a 5-mile run. It was a typical training run, no big deal. You wouldn't think of anything. And I went out, and during that run, I felt terrible. And I hadn't felt great for a while, but I kept pushing it aside, completely ignoring it. I had actually been to a cardiologist a few times, to a couple different cardiologists, because I'd passed out in marathons before, which is, by the way, a huge red flag. So anybody that has issues with exercise, any palpitations, any passing out, anything, go to a cardiologist immediately. One who sees people who do sports, so a sports cardiologist. But anyway, I thought I was fine because I'd been cleared, several times, but I went out and I felt bad, but I kept pushing myself, and I kept pushing myself because I was a year postpartum and I was sick of feeling bad. And I wanted to prove to myself that I was an athlete again. And so right at the last bit, the last half mile, I pushed myself as hard as I possibly could at that moment, running up a hill and finishing out in front of my house. And right before I finished, my heart started beating really fast, really far outside of my chest. And I could see it, but I started to get confused. So things didn't really click, especially as a clinician, which is scary. We don't always see what's happening in our own body as well as we do others. But my sports bra started to feel really tight. And I looked at my Garmin and it went from 150 beats per minute to like 220 all the way up to 300. And then it stopped tracking. So I looked, I thought, oh, my Garmin's broken. It didn't occur to me that maybe that was actually my heart rate. But then I didn't feel good. So I walked to my front steps. I put my head between my knees and I was breathing. And I'll tell you, I'm very lucky because most people that have what I have don't get that far. My heart converted back to a normal rhythm, and I was okay. And then the next day, I didn't really tell anybody, which is even worse, by the way. I'm admitting this on the air. I didn't really
just keep shaking my head.
Well,
I'm like, oh.
Every time I say this, I shake my head too. And if anyone ever says things like this to me, I'm like, oh, I've been there. I feel you, because it's so true. And so I didn't tell anyone until the next day. And finally, I told my colleague, and she canceled all my patients and said, go to the cardiologist now, which I did. So that really was an interesting experience because it really set off a huge change in my life and the way that I looked at things, and the way that I treated patients, and the way that I saw myself as an athlete, really. So it took about 9 months to diagnose me with a rare genetic heart disease called ARVC, or now they're calling it ACM, arrhythmogenic cardiomyopathy. And during that time, I really felt like I was losing pieces of myself. So I had such a strong, and I still do have a strong athletic identity as an athlete, as a runner. And when you're told you can no longer do that or you might die, it really messes with your head. And so I would go to these appointments and I would sit in these fluorescent light, crowded room full of sick people. And I didn't feel sick. I was an athlete. I was the fittest person there. And I didn't feel like I belonged or that anyone was listening to me. And it took so long. I finally found two really great cardiologists. I love them very much. But even through that process, there was so much that I felt like just could have gone better. And so that's what really impacted my practice now and the way that I look at people.
That's crazy. And as we're recording this, I think someone just passed this weekend at Ironman, and another in the swim. I don't know why that is a weird combination for, it seems, white men that are the ones having heart attacks in the water and passing away. But to be so young and to have this condition and not know, I mean, this is pretty fatal condition. This is not something where you're like, oh, you have to, wear a monitor and then we're going to put you on medication. You'll be okay. So how is that shaped who you are now? Because obviously being a parent changes, which makes me.
Yeah. So this whole thing. So I actually say that my son probably saved my life because I made better decisions because I had a child. I was too strong-willed and maybe not open to change before. And this really, I was that runner that would do all the hill repeats, run as fast as I could, as far as I could, push myself into the ground until I literally could do nothing. And then suddenly I did it to the point where I almost killed myself. And so that's a huge mind shift. And without having someone like a child that you're like, "Oh, I need to make some changes so I can stick around for my child." That was a really big shift for me. And so this is a rare genetic disease and exercise makes it worse and there is no cure. I'm on small amount of medication that helps with the arrhythmia piece. I had an ablation, which helps with the electrical piece. And then I have a ICD implanted, so a defibrillator underneath my arm. And that's really the treatment. And so now I still exercise. I'm lucky. Most people that have what I have either die suddenly. It's one of the, I think it's 3 or 4 top cardiac diseases that result in cardiac death, a sudden cardiac death, and you may never know you have it. And then you just die like this person at the Ironman. That could have been me for sure.
Yeah.
But now I still exercise. I run once a week for 2 to 3 miles. I always have to be with somebody. It has to be slow and I have to walk up the hills. There's all these rules, but we're doing it anyway. And I lift 2 to 3 days a week and I do some yoga and I walk every day. So I'm still really active, but that's not actually the norm for what I have. So I'm pretty lucky that I get to do that. But I honestly think it's because during this entire piece, like I really dove, just like an athlete, I dove right into recovery. I was like, okay, what do I need to do to get it together? I started meditating. I started working on my mindset. I started recognizing how your mental health, your emotional health impact your physical health. So for me, when I was anxious and depressed, my heart rate and my VT was through the roof. When I got that under control, I didn't really deal with that as much. And so it really is so connected. Your emotions and your thoughts and your beliefs, all that does live in your body somewhere. And so that was a really big takeaway from this for me. And again, I bring that to my patient care, understanding.
I love that because it does, again, I'll always say this, we need more people like you who understands that there's emotional aspect and you're dealing with athletes in vulnerable situations because they're coming to you hurt and they're not always aware of how they got there.
Yeah.
And they're just wanting to plug along and say, all right, this ankle, I just turned over my ankle. I just need to get it strong so I can get back out there. Can I hand cycle? Can I do other things to keep my body moving? When we're looking at it, why? Because runners are a different breed.
Yes, we are.
And of course, you add in trail running, which has like because you kind of thought marathoners were a little insane, and then the ultras kind of came in, and then the trail running slash ultras became a thing where people are like, "Well, my toenails are falling off, but I'm okay." It's a very different. So why are runners, I guess, wired that way? Why do injuries feel not that big of a deal to them where I could just run through the injury, or I can,
Yeah.
I don't know, maybe that's too big of a psychological.
That's a huge question, but I'll try to answer
Yes.
it. How about this?
Yes.
So, there's actually some research out there about how we frame injury differently. So, runners actually, according to the research, runners don't actually think they're injured unless they can't physically run anymore. And that's not the definition of injury. Injury, so it's a
The bone's not sticking out, I'm good.
that's right. And so there is research out there that shows that. And so that is a mindset. That is a let's push until we actually walk anymore mindset. And so we need to actually think about that as athletes. And I often say to my athletes when they come to me, because they come after they've seen so many different people, they are still not better, or they're just really frustrated and they're just not in a good place. And I often ask, like, why are you running? Like, what is it that you love about it? Why do you decide to push yourself even if you're getting all the red and yellow flags from your body? Like, what's happening there? So part of like what happens in PT is we have that discussion, the why behind what we're doing. Because if you don't understand that and you can't tap into that, then you can't really break the cycle. And so
Mhm.
it's very important to understand that so that we can relate to our athletes. And I can totally relate because of who I am and what I've done. I mean, I get it. Uh,
Yes.
and we have to know what drives that athlete so that we can figure out another solution. And maybe once we get in there and we understand the why, sometimes people are like, that makes sense. Maybe I don't need to push myself as hard right now, and we can make more
Mhm.
progress.
There's a huge piece in this because of well, aside from the fact that the question was psychologically impossible to answer, but because there is that psychological piece
Yeah.
for runners, and there's that grieving
Oh
is
my God.
probably the best way I could do it,
Yeah.
is that when any athlete
Yeah.
gets injured, there is a lot of predictive type grief that, "Oh, now I won't be able to do that race," or I don't know, like, triathletes seem to be, "I paid that much money, I'm gonna go out and do whatever." Like, even when I was hurt, I was like, "I'm gonna go do it anyway, and I just won't do the run. I'll do everything else because I want my money's worth out of it." And there is that kind of obsession of wanting to go and do it. And even as I was riding and going, "I can't run because I have this thing, this swelling in my knee, and this is not healthy." I was like, "Can I though? Because maybe I can go a couple of miles."
I'm sure I can do a little.
And then I got
Yeah.
off the bike and I was like, I couldn't even stand. So
Yeah.
I knew, right, there were some issues around this stuff. But there is this grief and grieving that needs to happen. How, as a physical therapist, do you kind of help us navigate that? I guess maybe the death spiral that we want to go on that
Yeah.
we don't have to go on.
Well, first of all, running for a runner is part of your identity. And so that's the crux of the issue, right? A lot of us, so what's happening is that when somebody gets injured and can't do the thing that defines them, they don't know what to do anymore. So it is a spiral. It is the death spiral. It's absolutely true because you don't know who you are as a person, where you fit into society. You don't know what to eat in the morning. You don't know what shoes to wear. You don't know what time to set your alarm if you can't go run, and you can't meet your friends for your social piece of your day. So it is innately tied within our identity and who we are. And so if you can't address that as a clinician, then you probably shouldn't be treating athletes and runners because it is so much of it. And so again, I think that one of the biggest things we can do to help our athletes go through this is acknowledge that. First, we have to acknowledge it and say, look, if you've been there, like I have been there, I get this. And you say, I often say, I'm really sorry. This is how you're feeling. But it's okay that you're feeling this. You have to feel it because if you don't feel it, you push it down and it shows up somewhere else. And so you have to talk about it and you have to be willing to talk about it. Sometimes my sessions are 30 minutes of talking in addition to what we're doing. Actually, it's usually an hour of talking while we're doing things, but a lot of talking and working through those things and then giving them tools and saying, sometimes I'll say, like, you really should see a sports psychologist. This could be really, really helpful for you because I can do some of the talking and the acknowledging and the helping, but Some people need to see somebody who is in that field as well. A lot of the things that I do is we help downregulate the nervous system. So when we are spinning in the death spiral of not knowing who we are, not knowing what to do, we have to help them gain some control. So I ask my athletes to build their goals with me. I asked them, okay, what are your most important things that you need to do? Let's figure out how we can do some of that. Sometimes giving them the bike works. Sometimes modifying their strength program works. Sometimes getting them on a body weight supported device helps them continue running without hurting themselves further. It's like figuring that out and then giving them some amount of control is really important. And then I might give them meditation for their homework. Everyone hates it. Everyone really hates it, but I do it. I mean, I hated it when I first did it, but I'll even say, I actually did this today. I had a patient who was spiraling and they were doing all the things right. And she really has been doing everything right, but to a point that she stressed herself out more. So she can't possibly get better. And so I said, let's stop everything and let's restart. And now set your timer for 2 minutes. That's it. 2 minutes of sitting down and closing your eyes and focusing on your breathing. And if you sit there, and even if you go through your entire list of everything you have to do, but then you stop one moment and say, "Ooh, I'm supposed to be breathing," and you take a breath, you've already won. And so that was homework I gave today. And sometimes I'll give an exercise that's focused on diaphragmatic breathing to help downregulate the nervous system, but also teaching that athlete that working on our breath can help with our deep core stability and our running posture. And so if you can connect it to the goals that they want to achieve, it helps so much.
Yeah. As you were saying that, I was thinking, because I used to implement it in some of my classes where I go, oh, well, yeah, I wrote a short workout today. Let's do some meditation. And we would do some Wim
Cool.
Hof breathing or something to that effect, just to kind of bring it in. Because as a clinician, when you walk into a room, you can feel the energy. And when someone's pinned, because of anxiety or whatever, sometimes you have to stop everything just to focus on
Yes.
kind of breaking that chain. So because otherwise they're not going to hear anything else.
That's so
And
right. Yeah.
they're so type A. And
Yeah.
so they did their homework. I did my homework. Why this is not working? Why is this not working? I did my homework. You told me to do 15 reps and I actually did 16,
I was
but
just
I'm
going to
not
say
going to tell you why.
25. I also actually call that out early on. I'll say, you are not allowed to do more than I've given you.
Yeah.
I know
Yeah.
that you're an A plus student, but being A plus in this situation maybe means doing less.
Yes. Yeah.
It's right. But you do have to read the energy when you come in the room. And you have to meet them where they are in whatever way you can. And I think to be a good clinician, you have to be flexible and you have to listen.
Yes. And I know from my aspect as being a client, that was the biggest thing for me was actually because I feel like we spend 15 minutes with the doctor, maybe 3 minutes with a nurse, but probably spending a good amount of time with you. And if you can hear me when I'm telling you I'm scared, or when I'm telling you that I know that if I do XYZ, it's going to cause pain and then I'm going to be out of it forever, or that fatalistic spin, if you can hear me and then like
Yeah.
give me a pat, rub my back, you're okay. I've seen other people go through this and you're going to make it.
Yeah. I think you just need reassurance sometimes. And I'm a
Yes.
hugger. I mean, you could tell if someone's not a hugger, but
Right.
I'm a hugger. So if I can do that for somebody and that's all they need that day, then that's fine.
Yeah. Sometimes we just need the mom energy to come in and just love
Totally.
us up and then send us on our day.
I
You
do
know,
think that some of my elite athletes consider me the team mom
yes, for sure.
because of that.
But you listen to your mom though. And that's a thing. And I know before I used to think that was like, I'm not your mom, kind of thing. But for the most part, a lot of these people do respect their moms and they appreciate the fact that somebody is looking out for them and looking out for their best interest.
Absolutely, because the whole goal is just to get them to a place where they can do what they love again.
Yes.
Time and then give them guidance and a plan. I think that that's the other thing that's often missing is when I was going through my diagnosis, there was so much confusion and ambiguity around what was going on. Nobody was giving me a plan and you feel lost. We're used to training schedules. We're used to timing things. We're used to that type of thing. And so if you don't have a plan to check the things off, that can also put you in a spin. So I try to give like some of my plans, they're actually really funny because they could be like a strength plan, but I always put the why, right? So I'll do a strength plan. I'll say, this is why we're doing it. This is how we progress. I'll say, and this is your mental health or this is your stress relieving activity for the week. And I give them ideas like in a column, and I'll say, try these things based on what they like. Like some people like to cook. Some people like to just spend time with their family or play games. So I will figure that out in the evaluation, and we'll talk about it. And I put that in the plan with the strength, with the running, all of it.
Well, if I'm going to do my homework, then I'm like, I'm going to connect with a friend because she told me to.
Exactly. But then that gives you that connection that you need, that you're missing, and it's part of your identity. So if it's
Yes.
in the plan, we're winning.
Yes. There you go. So speaking of, you have an app that you have. Yes. And you incorporate technology into part of your recovery. And so I'd love for you to explain your app and how you utilize this to assist your athletes in their recovery.
So it's really exciting because by the time this comes out, have been out for several weeks, the new version. So it's been pushed up to the Apple Store and the Google Store today, and we just have to have it approved. But Run Source is the name of the app. And the first version was just like proof of concept. And I have got to get this out before I die, like in my brain. And I used it with some of my athletes and people, but it wasn't that functional. It wasn't intuitive to make sense, and it didn't do all the things I wanted. So this version is so cool. I've created injury programs because runners and athletes are afraid to go to the doctor in a lot of ways. Okay. So only about 25% of athletes actually go to see a healthcare provider when they're initially injured, or even when they realize they're injured, because sometimes they don't believe they are if they're not running. And so that leaves 75% of people out there that are actually searching ChatGPT and Google and asking, like crowdsourcing their injuries. This is a huge issue with running culture, even
Reddit.
though, yeah, Reddit is like the worst. And there's actually a paper about this. And I have a paper coming out about looking at runners' beliefs, attitudes. And anyway, so what's really interesting is that we ask everybody else except for the experts what to do. And that only makes the problem worse. But it's because of the fear that we're going to tell you to stop running and that we're not going to listen and nothing's going to get better because we've had a bad experience somewhere else. And so that's not always the truth. So I made this app as an entry point so that people who didn't feel comfortable going to a healthcare provider, or maybe couldn't afford it, or didn't have providers that they trusted nearby, had access to some of the top running medicine people in the country and world. So it's like right around 50 experts on the app. So sports dietitians, PTs, MDs, we have some strength coaches, running coaches, there's meditations. All these people came together and shared their knowledge. There is running injuries. They're about 80% of all runners, and it's been the same for 40 years. But there's another paper that recently came out that said that education can actually impact running injury. And so there's a lot of education in this app. So you can, if you have an injury such as an Achilles tendinopathy, you can say, you come into the app and it asks you all the questions that I would ask you if you were coming to see me. And then you could say, I want the Achilles program. And then it's at 8 or 12, I can't remember how many weeks, a program that I wrote that has a strength program in it for every week. And then it has videos, educational videos every single week from all those experts, whether it's about nutrition or shoes or training volume or overtraining or heart rate variability, whatever it is, so that I can help you and we can help you learn how to not get injured again while you're going through this program. And then it also has a couple agents. They're not like typical. So people get afraid a little bit now with AI, and I know why. But I created a closed system where we're using AI just to retrieve information. So I built out a running knowledge. It's really crazy. Over like all of this knowledge that I've accumulated in 15, 16, 17 years, I put it on this app. Research papers, clinical patterns that I have in my brain, injury patterns, all this, and it's all in there. And so you can ask it's Catherine, which is me, and my son's name Andrew is the second person or in there. And so you can ask Catherine, like, I have pain in my foot. What do you think it is? And it'll ask you questions that I would ask you, and then it'll give you some ideas about what it might be, and then it'll direct you what to do. And then you can ask any other running questions that maybe one of the other people or from our app or our knowledge base have about running, and Andrew will answer that. So this app is built to decrease injury risk so that we can consistently train. And when we can consistently train, we don't overtrain, we're happier. And if you have an injury, this is a way back. And so that's how I'm using technology. And there's a really long answer. I'm sorry.
No, that's crazy. I love it.
Yeah.
I absolutely love it because I notice now when you go to physical therapy, they do give you videos, but once you're done with your cycle, you lost access to those videos. And to have something that's reliable for one piece, because sometimes YouTube,
Yeah.
again, you're open to everything.
Yeah.
And you may not be getting the correct information in terms of how to address a particular injury that you have. And so this is great. Because I have people are, I'm going to get a shot. It's like, okay.
There's actually videos in there from a physician that talks about orthobiologics, like PRP and all those things. And so you can ask it about that, or you could go and it'll send you to the video that the doctor talks about it and explains it in there so that you can have some background information. And so this is really trying to get the best education that most people don't have access to everybody. And it's so specific. It's running medicine. That is a real niche, but there aren't many of us. And so you have access to all this. And what's cool is like your athletes, they could say, I'm having this pain in my butt, right? And you're like, whoa. And so you put, I have pain in my butt. And it says, is it your actual booty? I
Right.
actually made it say that.
Or a
Is
hamstring.
it the back of your leg or is it in your back? And then you tell it, and then it says, okay. And it'll ask you a couple of follow-up questions, like what makes it worse, what makes it better, all these things. And then it'll say, okay, based on this, it could be a high hamstring or your back. That might ask you another question. But if it's something that looks like a bone stress injury, it says go to the doctor. So the app even says, like, you need to see a doctor. If you ask the same question over and over again, it says it's time to go see somebody. And so it sends you. So this app is not supposed to take away our jobs. What it's supposed to do is get the people who are not coming to see healthcare providers something that they can build trust and then direction so that they go to the right providers.
Well, and what I like also about this piece is that you are educating people, and that's something that has been proven over and over again, that when you go to the doctor, then there's that piece where we're sitting there and we're trying to play detective and figure out. Now, if I could walk into your office and say, I have this pain in my butt, and it's really originating here in my high hamstring, and I did this when whatever, or I'm running and this is what's creating the issue, or when I'm squatting or doing deadlifts or whatever, then as a clinician, you're all right, I could check down this list. And then now you get to go to the correct portion of the treatment as opposed to being at the beginning.
Well, right. And
So
so
that
instead of
makes your job more efficient.
yeah. And so also like with that example, as an athlete, you would say, I have pain in my butt. And you ask all your friends. And maybe somebody had pain in the butt that was a hamstring. Maybe somebody had pain in the butt that was low back. Maybe somebody had pain in the butt that's piriformis syndrome, which is not very common, even though everyone thinks it is. So
So many people tell me they
everyone
have
says
that.
piriformis. No, no, we
Yes.
don't. It's probably referred from somewhere else. But so then you do all of those things your friends say and nothing works because you're not doing the correct thing. And so this at least narrows it down. It gives you guidance and it tells you when you need to see, like, again, it tells you when you need to see something and it educates you. A lot of times it'll say, so if it says hamstring, it'll also in the notes say, this could be a hamstring issue. However, if you have poor neural mobility, you might also need to do nerve glides, or you might need to do, so it gives you guidance. And again, it's not, medical advice. You obviously but it's guidance so that you can get to the right people and the right things. And if you're not going to go somewhere and see somebody, I'd much rather have you do this than try to figure it out on your own.
Absolutely. That is fantastic. So when you're dealing with this pain or setback or whatever, what is some guidance that you can offer athletes aside from like get my app? Cause it's really cool.
It is really cool.
But how can you help them? What is the first step if I'm finding out that I'm injured and but I have a race coming up and I'm feeling all the things, like what is some advice that you would be willing to offer somebody to maintain their motivation and just be able to kind of not suck it up, because
Yeah.
language is important, but
Yeah.
navigate the challenges of being injured?
So not every injury means you have to stop running. That's the first thing. And I don't want people to take that and say, Kate said I don't have to stop running ever, because that's not the truth. The truth is that there are injuries that you can run through as long as you're getting the treatment that helps you get through it. So you don't always have to stop. And that's why I said, please go see somebody, because they may give you the things to do and you're still able to train and do your race. A lot of times we get people right before a race, and our treatment is, say, right before the Peachtree Road Race in Atlanta, the week before. Our clinic is crazy because people are like, I have never done anything to help myself. I've been running for so long with this pain, but now the Peachtree's here, so I want to run the Peachtree. And so we'll do spot treatment at that point. And then we'll get to the root of the problem. We'll let them know what it is. This is what we're going to do, but let's just get you through the race so that you can, and then come back so that we can actually deal with this. And so there is that. So you can, if people understand running injuries and they understand the mindset, there are people that do that, right? So that's the first thing. The second thing I would say is get somebody that actually listens to you. If they're blowing you off, they're not going to give you good advice. If you go into an appointment and they're like, oh, you're crazy because you're a runner, you don't want to see that person. You just don't, because they don't get it. You want to find someone that'll listen to you and that they get you, because then they start there and they can meet you where you are. And then they apply the research, and then they apply the clinical practice things that actually help. So I think that is really, really important. And then the other piece is ask yourself, why are you running through this injury? If you're running through an injury, what is the payoff that you're going to get to keep running? Is it worth it? And it might be. The answer for some people, it's yeah. I don't care if I can't walk next week because I'm going to the Boston Marathon and it is worth it. So fine, it's worth it for you and you'll deal with the consequences. But if it's just a 5K that you've done a million times and you're just going up, do you really need to do it? What's the payoff there? Nobody else cares if you run the race. That's what you have to realize. And so asking yourself those questions are also really, really important in getting down. And again, that's that mental side of it. That's that mental health and mental check-in. So I always, I ask people to do that. Check in with yourself mentally. Ask yourself these questions and then find someone who can support you on all those levels.
Fantastic. Kate, thank you so much for joining me today.
Yeah, you're welcome. I'm so glad.
How can people get in touch with you and ask you questions and
Yeah,
anything?
sure. So I have a podcast. It just came out last month, I think. So it's with a sports dietitian and a running medicine physician and myself. And we actually break down difficult cases. So people can email us cases and we'll go through them. And it's really fun.
Awesome.
Yeah. So if you have a case, email. It's interdisciplinary case miles. So that's the first thing. So I have that. It's free. Just listen to it. It gives lots of good advice. And then you can follow me at Kate Mihevc Edwards on Instagram. And Mihevc is Mihevc. And that's also my website where it shows everything. So I do like running courses. I do injury consulting. So if people have injuries and they just can't figure it out, I do like free 15-minute calls to help them out, see if I can connect them with somebody else, or I may end up working with them. And then, of course, the RunSource app. The RunSource app is a great tool where you don't directly interact with me, but you interact with my brain in so many more ways than you want to know.
That's awesome. Thank you again. It was great having you.
Thanks so much, Gina. I really appreciate it. Have a good night.